I've been in a customer service role for 30 years, and I've been with Lowell General for the past 8 years. And I started as an office manager at our largest family practice, and then for the past 2 years, have been the patient experience program manager. So when Amy and Jan first approached me and asked me if I would participate, I was like, okay, where am I coming from? Am I coming from a patient experience manager perspective, or am I presenting from the office manager's side of the desk? And they wanted me to present to you today from both advantages, from both sides of that desk, if you will. So I look at it as a push-pull sort of mentality. As a patient experience program manager today, I'm pushing out the scores. I am bringing them out to the practices, and I'm getting them all excited and just, you know, presenting it to them and selling it to them. From an office manager standpoint, I'm receiving it, I'm pulling it all in. What do I do with it? How do I interpret this? How did we get there? I'm collecting the stories. Where do we come from? How do we get to where we are? What do we do great? What do we do not so great? And so this is, I think I have the best of both worlds in terms of I'm in the best position to do what I'm doing today because I have a lot of empathy for everything that's going on today. So, but one big thing, and one great advantage I have is I know I can pull back and I think back about going back to the basics. In other words, we tend to overcomplicate things. We look at all this data, we look at all these trends, and we look at all that. Why are we here today? Why do we have the scores that we have, good or bad or indifferent? So what we did was we decided, let's go back to the basics, pull back all the layers of the onion. And you know what? You think about your kids. You think about, my kids are right now going through their finals in high school and everything, and they're being tested on curriculum that they were taught throughout the year. So you step back and you say, how can you expect our staff, our practices, to be tested on something that they don't know what's being, you know, tested on or what's being asked of them? So we literally took the questions that are being asked of our patients and taught them to our practices. We taught them to the doctors, the nurses, the front desk, the billing staff, everybody else. Everybody knows about the questions. And then we looked at each question and we created like these target answers or the target words, if you will. So for instance, when it asked you, did your provider give you, to respect what you had to say? Did they give you easy enough to understand information? These were all the great things that we talked about. And so they had these trigger points in their head where, you know what, I need to talk about respecting my patients. I need to talk about and help them understand, maybe, you know, do you understand what I'm saying? You know, that parroting sort of kind of thing. But you know, this last bar I said here, everything starts with empathy. You can teach all you want. You can show them the questions. You can do all that. But you know what? Unless people understand what it's like to walk a day in our patient's shoes, they become robotic. Let's put some humanity back into what we do every day. Let's step back and let's feel what it's like to be our patient. So I got to tell you, everybody, this Cleveland Clinic empathy video is amazing. If you have not seen it, please share it with your staff. It is so wonderful. It's just amazing. I'm not even going to speak to it anymore because I think it does its own justice. You know, you really, really, truly have to see it for yourself, and then determine whether or not you want to, you know, go ahead and whether you put it in a. I actually, when I started doing my training sessions, I didn't do anything else. I went and started this, and I let everybody know, you know what, our patients present in the different ways that they do because there's a reason behind it.